When you ask what Espie means to me, it's quite a difficult question. I feel as though it's been part of my life for 10 years or more. I was in the room when we were planning before the planning. So it feels like a big chunk of my professional life, genuinely. And when I think of it, and it sounds a little hyperbolic, it sounds exaggerated, I genuinely believe the hundreds of people who have worked on the Scottish Patient Safety Programme have transformed the safety culture of Scottish health and social care. I think the greatest achievement of the Scottish Patient Safety Programme is not the individual harm reductions, although they are globally best in class. So the infection reductions, the mortality reductions, the falls reductions, they're crucial to remember. And lots of people have worked really hard on them. But the most important change or outcome, I think, is the culture change within the health and social care system. So I met some trainees recently in an Aberdeen hospital, and two things struck me about the conversation I had with these doctors and dentists in the evening. One was that they had never seen some harms that I had grown up with. So they had never seen a C. difficile case. They had never seen a central line infection. They'd never done an operation without a surgical checklist. That is real change. But more importantly, they had a different attitude to harm. They talked about harm as if it was something they could improve and fix, not an inevitable consequence of healthcare, which is how I learned harm. It was something that we couldn't do anything about. It just happened. They believe they can fix it. That's culture change. I usually describe it in terms of aim, leadership, and method. So we had a clear aim. Most people thought we were overambitious. We said we were going to reduce mortality by 20%. We were going to reduce harm. We were going to fix the safety culture in Scotland. We had clear leadership from the very top. And we had a health minister who stood up in the Parliament and said, this is what we're going to do about harm in Scotland, in the health and social care system. And then we had method. And it's a little geeky, but we had actual improvement science. We used a method which had data, it had iterative testing, it had empowerment of the frontline staff, it had jobs for leaders to behave differently. So those core elements of the way we ran the Scottish Patient Safety Programme, I think, are crucial to its success. The Scottish Patient Safety Programme has not only influenced Scotland, but I genuinely believe it's influenced the world of improvement. So it has been an experiment for improvement science. Nobody else, no other country or health system of this size has tackled a big subject using improvement science. So we decided 10 years ago, with the politicians and the leaders of the system, to say we're going to correct harm as best we possibly can. The Scottish Patient Safety Programme has outgrown its original idea. The thought that we could bring a few hundred people to a conference centre every 3 months and teach and learn together, that worked for a few years because we were in our infancy. Now we are bigger, and every health board, every integrated joint board, every GP practice, every dental practice needs to be inside this game. So we need to think differently about how we're going to do that. And I think our biggest priority for the next decade is how we replace our method with a new method. It needs to be much more local. It needs to be led inside the health and social care system, and we're building capacity to do that. So the 3 words I would choose to describe the Scottish Patient Safety Programme are empowering, relentless, and evidence-based. I think it's important at 10 years of the Scottish Patient Safety Programme to do 2 things: to celebrate the success and to thank the staff who have delivered that success. And I would genuinely congratulate the professionals across our country and in the health and social care system who have delivered the infection reductions, the mortality reductions, and the culture change that we all can see.